How deep relationships with community informs our grant making. The coronavirus pandemic has opened many of our eyes to how sectors and systems do or don't address the ever-growing health and income inequities in this country. We can approach this realization in two ways. One, we can admit the inadequacies of our systems, especially those focused on health, housing, food insecurity, and education. Or two, we can go a step further to recognize that our existing systems have not been built with the safety, dignity, and well-being of BIPOC communities in mind. For philanthropy, what does going a step further look like? In the last few months, we have seen the sector issue solidarity statements and commit to easing reporting and funding restrictions, especially around general operating support. We applaud these trust-based approaches and recognize that trust takes time. And our intentions must align with our action and impact, not once, but every time. If we want our communities to thrive, we need to reimagine our systems, our policies, and how we engage with community to address the root of our inequities. No single funding strategy can magically erase the impact of generations of structural racism and income inequality, and not much will change without the leadership and insight from those who are most impacted. As a Health Conversion Foundation committed to community-led approaches, the team at the Healthy Communities Foundation was in many ways primed for this moment. But that's not to say we weren't tested. We've had to put our values into practice, evaluate the efficacy of our policies and operations, and most importantly, reinforce the ways we aspire to be in right relationship with grantee partners. Being in right relationship is a concept we humbly borrow from our peers steeped in Indigenous traditions. It's an orientation that acknowledges our connection and interdependence within the ecosystems of our work, which in the book Braiding Sweetgrass, Indigenous Wisdom, Scientific Knowledge, and the Teachings of Plants, Robin Wall Kimmerer reminds us is applicable beyond the plant world. It requires that we recognize the sacredness of our relationships with ourselves and the values that drive us, with grantee partners who intimately understand how issues impact their communities, and with peer funders to strategize nuanced responses that center community voice and lived experience. Taking a cue from the article Resituating Reciprocity in Our Relationships, we ourselves are community members invested in lifting up structural inequities because they harm all of us. When we embarked on a new strategic plan 3 years ago, we explicitly named addressing racial equity as a key to achieving health equity and ensuring all residents in our region could lead full, healthy, resilient lives. We also committed to being agile and adaptive in our decision-making and actions. The unique makeup of our board and staff has in part enabled our response. No one on staff had prior experience in philanthropy, but we have extensive experience in the nonprofit sector, as well as community organizing and cultural organizing work. And we're all committed to our values-driven mission that centers equity and justice in our processes, relationships, and aspirations. We also understand that nonprofits, especially those led by communities of color, can struggle to access capital. Oftentimes, many are neither able to navigate the shifting public and private funding landscapes, nor do they have the infrastructure to weather a crisis. Our board is reflective of our community demographics. Members either live, work, or have some connection to our region. And with their support, we've already committed more than 90% of our grant making to general operating funds. We have also streamlined our grant making and reporting processes to align with a trust-based framework. For us, community engagement is not an afterthought or a separate strategy. It's part of a deep-seated commitment to achieve health equity through reciprocity and interdependence. And this spans our relationships with each other, our grantee partners, our peers, even the land and geographic footprint of our work. We're still learning and growing, and throughout the journey, we reflect on how we can be in right relationship with our communities and in alignment with just actions and policies. Here are a few questions that have guided our reflection. How might existing philanthropic practices perpetuate harm in community? Do current practices place undue burdens on organizations or box out leaders, especially leaders of color, from networks and resources? How is our staff and leadership reflective of the communities our foundation represents, whether through our demographics, our lived experience, or deep familiarity and expertise of community issues? Which communities and populations are missing from the data that's available to you? Whose stories are being told, and from which perspective? How do our application and reporting processes impose a greater administrative burden on smaller and under-resourced organizations? The recent SSIR article, Transformative Capacity Building, takes a deeper dive into other ways to take a race-explicit approach with insights from the Rainier Valley Corps. It is our duty and obligation to consider how our practices, policies, and strategies are evolving to meet the complexities and needs of our communities at this time. Our paths may differ, and we might not get it right every time, but we can either continue to address the symptoms of larger structural issues, or we can deal with the issues themselves. To achieve the change the world needs right now, the key lies in our relationships with community.